Hi, everyone. This is Podcast for Patients with the Aplastic Anemia and MDS International Foundation. I'm Leigh Clark, Director of Patient Services. Our podcast series is brought to you with special thanks to our patients, families, and caregivers just like you and our corporate sponsors. Thank you to everyone for supporting this series. Today, we're going to be talking with Brian Anderson and his journey with MDS. Hi, Brian. Welcome. Thank you so much for joining us.
Thank you, Leigh. I appreciate it. It's great to be here.
So, Brian, tell us a little bit about you.
Sure. I'm 58 years old. I live in Washington, D.C., right on the wharf, and I have 4 grown kids, one to be married in 2024. So it's kind of an exciting time right now.
Thanks, Brian. And you were diagnosed with MDS, but before we talk about that, what was going on before your diagnosis? What was going on in your life?
Sure. It was interesting in that I was running half marathons, doing triathlons. I was fairly active. I really had no symptoms. I had no idea that there was something, in a sense, brewing, for lack of a better term, inside my marrow until a routine doctor's check. So I was a consultant, working hard, raising family, and doing all those normal things without any notion of this thing called MDS. And even when I heard about it, I still didn't know what it was.
So what led to your diagnosis?
Yeah, so I was coming up at that time. I was coming up toward my 50th birthday, and I decided to visit my doctor just to make sure I got a clean bill of health, and I knew it was an important milestone. So I went to go see him. He took some routine blood tests, and then called me back later that day and said, "Hey, can you return? I think we maybe had some contamination or something. I'd like to redo the blood." We did that. And he still was puzzled and said, "I need to send you on to specialty to investigate this further." So that's a routine type of thing, but that's how I found out.
And then once you received the diagnosis, what were you told was MDS?
Well, so it was interesting. That diagnosis actually took a while. This was 2012 or so, and we really didn't diagnose it until 2016. So I had about 4 years of waiting around. And when I was finally diagnosed, this is down at Moffitt Cancer Center in Florida. It was through a bone marrow biopsy, and they came out with this thing, said, "Hey, you have this intermediate risk MDS." And then we went through in sort of painstaking detail what that entailed, because like I mentioned earlier, I had never heard of that disease. I've been in healthcare most of my career, and it was completely unknown and took me by complete surprise.
And Brian, what took so long to get your diagnosis?
I think a number of factors. One, I think back then, MDS wasn't, as you at the foundation would know better, but it wasn't necessarily known as well within general PCPs and even hematologists. But even then, they were looking and trying to rule out other things. So I presented a little bit atypically than most MDS patients, in that I was on the younger side. It's arguable that late 40s is young, but from an MDS perspective, it was on the younger side. So they looked at copper deficiencies and other type of viral things that perhaps can be contributing to my low numbers, and not necessarily MDS. And it really wasn't until I saw a specialist in MDS, aplastic anemia, at Moffitt, who then said, "We need to do another bone marrow biopsy and really look at this and get to the bottom of it," that it was diagnosed. So it wasn't that they were not doing anything. It was a lot of testing, but really to rule out that it was to look for MDS.
So you sought a second opinion.
Yes, that's correct.
And that was your trip to Moffitt.
That's correct. Yeah, I realized at that point, after about 4 years, my doctor then said, "Hey, I really don't know what to do next. I think we should try some steroid therapy. And I said, well, before I take some steroids, let's really see if we can nail down a diagnosis, and then sought out a second opinion. And even after that, I sought out a third and fourth opinion. So I think one of the lessons learned that early on was rather than just sort of sit back and have doctors say, I think this might be what it is, I should have been a little bit more aggressive, perhaps, in seeking out additional support and help in the form of a second or a third opinion.
And once you got that confirmed diagnosis, what type of MDS were you finally given as your classification?
Yeah, so it was with excess blasts. My blast count was still low. It was 6%, but I had all three of my cell lines were down, my reds, my whites, and my platelets, but chiefly it was manifesting in the blasts and really low white cells. But it was the official diagnosis was MDS with excess blast, intermediate 1 risk. Yep.
Were you considered low risk MDS?
So that's that fuzzy line where intermediate folks are. There's a lot of studies that talk about low risk and how to manage patients. There's a lot of studies and information on how to manage high risk. I was this intermediate 1 low, but according to the IPSSR, I am intermediate, and it was this gray area where I kind of sat. Most of the treatment that I was taking at that point was watch and wait, which was more aligned with that of a low risk patient. So I guess to answer your question, I was more considered a low risk side, but I still had that intermediate diagnosis.
How did that feel to be watch and wait?
I think at that point, when I first heard it, I challenged the doctors and I asked for an immediate consult to the transplant center to talk to them and get their opinion on transplant. I thought that I'm healthy, asymptomatic. Now is the time. What better way to handle this was to immediately just attack it. But that didn't happen. And the tumor board said, I am not a good candidate at that time. And as you said, I was on watch and wait. Initially, I was frustrated. I was angry because you want to do something. You want action. I wasn't taking medicine. I wasn't doing anything other than taking vitamin D and vitamin B12 pills. So over time, I began to get used to it, but I think that started to eat at me emotionally. It's a heavy weight over time. A couple of months you can take it, but when I was talking, this is 2016, over time, it really began to weigh on me. So I'll say it was not easy.
How did the diagnosis impact your life?
I think at first we didn't see a lot of impact because I tried to bury that. Let's just continue doing what I'm doing. I'm working, normal family. Let's just go and do stuff. But over time, as my numbers began to get lower and my white cell count made me more and more immunosuppressed, I think it affected me more in an emotional and mental capacity. I noticed that I wasn't as effective on my job as I used to be, and it just began to bother me a lot. And at some point, I reached out for some support, some mental health support to help me work through that stress, that anxiety that began to build.
Did your disease change?
Yeah, it did. We were watching and waiting, as implied by that term, waiting for something. And I think that's where that anxiety built. And in 2022, so just June of last year, my hemoglobin dropped precipitously. So too did my platelet counts. Something was happening. It triggered my oncologist to then do another bone marrow biopsy. That was done by National Institute of Health here in the DC area. And lo and behold, NIH said that I was, quote, transitioning. And so my blast count increased, and they noticed that, I was rapidly on a path changing path. We had to do something now. And so that time when in 2016, when the doctor said, no, now is not the time for a transplant, in 2022, that's when they said, hey, you know what, something's happening. We got to do something now.
And how did that settle with you?
It was a bit of a shock, a bit of a relief. I was finally now back on that mental path of action and doing something positive that I could potentially use as a cure, that I can now move forward and enter into treatment and do something that was actionable, which was something that I've been wanting to. So I guess I took it positively at first, and still do. I'm glad that that happened, I guess. for I know that sounds weird, but in a way that I was very, very happy to be in that changed status. Now I knew something, and I had information, which is good.
And with the change in your diagnosis and the progression of your MDS, how did you tell your family that things were changing for you?
Yeah, the family, I've always kept them up to date on my progress. And so as soon as I knew something was different, that first lab value that said something is down, I let them know. We had a phone call and we just talked. Of course, it was caveated by, we don't know anything yet, still haven't talked to doctors, had my bone marrow biopsy. We then had more calls. And again, it was always caveated by saying, this is what's happening. There could be different things. This could go in many different directions. But from the very beginning, it was always, phone calls, conversations, sitting around coffee tables and just talking this thing through. I think it affected my family just as much. They were just as concerned. And, sending out a bland email or just a text saying, I'm doing something, some tests, I don't think works as well as just simple conversations, staring my family members in the eye and saying, it's going to be okay.
And now you're looking at transplant.
Yes.
How was the discussions about transplant and with your team? And because going to transplant is a big decision.
And it's so big, in fact, Leigh, that I, for lack of a better term, I shopped around for the best transplant team options for me and my family. I live here in DC, right on the wharf, right in the heart of the city. So there are many options around: UVA, University of Virginia, Georgetown University Hospital, Johns Hopkins is a big one, and a lot of people go there. So I went to these organizations, sat down, talked to the doctors, examined the facilities, and talked to my family about what would be best for me, for them, and we actually did a very comprehensive pros and cons type of exercise where we listed all the benefits and the negatives for each place. So this was a very time-consuming yet important thing that we did, was to sit down and make sure that we were looking and doing things that were right for us and for me.
And Brian, how did the donor search go? Did you end up with a related donor or an unrelated donor?
I ended up with a 9/10 unrelated donor. All I know is that some very generous 25-year-old male in Germany donated his stem cells, and I am obviously forever grateful, and hopefully at some point I'll be able to meet him and thank him in person.
How was the preparation for transplant?
I think for me, it was a little easier perhaps than others, in that I had been in this, I'd been with this disease and been in this environment now for many years. And so I've had the time to research and talk to others and talk to people like you and learn from your organization and understand, what could be happening. So I was pretty well set. Of course, even trying to do more exercise and getting physically ready was also a key component. So I kind of focused on getting my emotional health ready, my physical health ready, making sure my family was prepared. And at first, it seemed like these were all easy things, but when the time starts getting closer to transplant, you begin to run out of time. So I think in the end, we did a lot of planning. I think we had that advantage of knowledge of what may be happening, which helped me plan better. Gave me a lot of security that I was doing the right thing going into the transplant.
What was transplant day like?
I've heard this before. The actual transplant day was almost anticlimactic. We had the preconditioning chemotherapy, and I had radiation, and then they hang this teeny little bag of stem cells, almost a clear, opaque, yellowish type color, and they hang it, a couple of bags, and boom, you're done. And like, well, that's it. That's my new life in a sense. At first, it was just kind of almost not a disappointment, but just like, oh, an anticlimactic. But then as that wore on, you kind of realize what that meant. Here was the start of my, in a sense, a new life, and it gave me a second chance. By the end of the day, it was a very emotional and thankful day for me and my family.
So since transplant, have you had any challenges?
A great question. I did. I had two major challenges. One, the night that I came home for the first time, my leg swelled up. It was pretty bad. We're not sure what it was, but it was some type of immune response, clearly tied to my new stem cells. And so I had to go back to the hospital and take care of that. And I struggled with that problem for about 6 months. I also had acute GVHD of the skin, which was treated successfully with the typical medicines that are available to the doctors. But all those things kind of in the end, you get a little bit concerned. But overall, besides those two events, I had a pretty good time, relatively speaking, post-transplant, and still am doing fairly well.
If you could change anything about your journey with MDS thus far, what would that be?
If I can change anything, if I could, I would, knowing now what I know that we transitioned, it would be great if I could have gotten a transplant earlier. Living with the watch and wait and living with just that unknown is so anxiety producing as to be sometimes debilitating. If I had in an ideal world, I would have moved this up earlier. But minus that, I think at a simpler level, something that I perhaps could have controlled better was just simply earlier learning to be more day to day in my focus, and just accepting that today is not a great day and tomorrow will be better, or I'll have a chance at tomorrow being better. So just taking things a little slower, taking things a little bit easier. I struggled with that earlier in my journey, and I think it took me a lot longer than it should have for me to learn that lesson.
And Brian, your last question for you, what would be your advice for other MDS patients?
Yeah, that's a great question. I think one, get a second opinion. Ask people like yourself, Leigh, that know the doctors and the facilities and that are treating MDS and aplastic anemia patients that have experience with this. Your local doc, he may be a great guy, but there is some nuance and a focus of this disease that perhaps not everyone understands. So reach out, get a second opinion immediately or as early on as possible. And I also think too that once you have that diagnosis and whether you have you're being treated, you're on some type of chemotherapy regimen or other type of treatment options. Now, I mentioned the day-to-day thing. Try to focus that mindset. And if it means getting some mental health support, I think that's invaluable. A lot of times, I wish I had done that earlier, but just to step back and take things differently. You now have a cancer. You now have something that can be traumatic and difficult with, people having fatigue and all that. Just taking a step back, taking it day by day, and saying it's okay. Today is maybe not my day, but tomorrow may be a better one.
Thank you so much, Brian, for sharing your experiences and your journey with MDS with all of us. And if you'd like to learn more about MDS, about treatments, or about transplant, please visit our website at aamds.org. You can also learn information by following us on Facebook, Instagram, or X, or give us a call on our helpline at 800-747-2820. This concludes our podcast.